My name is Dr. Juan Yepes. I'm a professor of pediatric dentistry. I'm one of the attendings here in the dental clinic. Probably our strongest item in our portfolio that we can offer to our families is that we are dentists, but we have a strong knowledge about patients with medical issues. In fact, we work in a hospital next to all the medical specialties. So patients with osteopetrosis, they have the tendency in the primary dentition for the baby teeth to exfoliate way before the time. Imagine a tooth supposed to be out, a baby tooth supposed to be out at the age of 7, 8. Patient with osteopetrosis, that out will come really early on, and that can bring an issue because that baby tooth is in the mouth for, helping to eat and to chew, and also to saving the space of the future adult tooth. So early exfoliation definitely is a potential issue that we see in the primary dentition with patients with osteopetrosis. Plus, the bone is more fragile, as you probably know. That bone more fragile is more susceptible for trauma. And, in different circumstances with a normal bone, maybe you hit the tooth and, that will break the tooth. But if you have osteopetrosis, even minor trauma can affect not just only the tooth, but can also affect the bone. So that's probably the most common issues in the primary dentition with osteopetrosis. Patients with osteopetrosis, depending on other factors, but generally speaking, they may need to come to the dental office maybe one more time per year, sometimes even twice more a year. So that means every 3 months. Why so often? Because we are crazy keeping that mouth clean. Absolutely crazy, because we know that the dental plaque and the gingivitis and the periodontal disease on the top of osteopetrosis is not a good combination. So your dentist, if you come to Riley, we are the ones who maybe are going to suggest to come a little bit more often to see us. We also explain to the insurance company that coming maybe 3 or 4 times a year will prevent maybe spending more money in treatment, because we are doing prevention, and prevention is always cheaper. So we send letters, and I would say, generally speaking, we always, I don't want to say always, but most of the time we get success. We get the insurance company to approve these extra visits. Generally speaking, osteopetrosis is a potential barrier for orthodontic treatment, generally speaking. But I need to be very careful here because it's almost patient by patient. I don't like to say case by case, because I don't talk about cases. I talk about patients. So it's almost patient by patient. Because in orthodontics, basically they need to move the tooth within the bone. And if you have some bone issues, maybe the tooth will move faster or slower, and that may bring some issues. But I mentioned that it's patient to patient because sometimes maybe it's a minor ortho movement and they don't need to move the whole mouth, just a couple of teeth to align. That will be probably fine in a patient with osteopetrosis rather than having a full ortho movement. So I don't want to be pessimistic, I prefer to be optimistic. So you think that your son or yourself with osteopetrosis, you may need ortho treatment. I think so the final decision will be taken by the orthodontist based on your particular situation, how extensive is your issue and how extensive is the teeth that they are going to move to take that determination.